You wake up in the morning and everything feels fine, maybe a little stiff, but fine. You make your coffee, you settle into your favorite chair, and you turn on the news or open your phone. An hour passes, maybe two, and then you try to stand up. There it is, that deep, grinding ache in your knees. The kind that starts somewhere behind the kneecap and radiates outward like a slow burn. Your hips feel locked, like someone tightened a bolt you didn't know was there. You reach for the armrest to push yourself up, and for just a moment you would never admit to anyone, you wonder if you're going to make it to your feet at all. You take a few steps, and the stiffness begins to loosen. Slowly, reluctantly, like a machine that has been left out in the cold. You try to recall when this started. You can't pinpoint a single moment. It crept in quietly the way most damage does. Maybe you've noticed your knees ache more on the days you sit longer. Maybe your hips have started making sounds they never used to. Maybe you've started shortening your walks. Not because you want to, but because the discomfort afterward just isn't worth it anymore. If that story sounds familiar, pay very close attention to the next 18 minutes. Because what I am about to share with you could be the difference between staying mobile and independent for the rest of your life or spending your later years in pain you didn't have to carry. My name is Dr. Qalb, and today we are having the conversation that nobody wants to have, but that millions of people, especially adults over the age of 60, desperately need. Today's topic is what prolonged sitting is doing to your joints, specifically your knees, your hips, and your lower back, and why, after the age of 60, the damage happens faster, stays longer, and hurts more than most people expect. Here is exactly what we are going to cover today. First, what is actually happening inside your joints when you sit for too long, and why it is not simply about being out of shape. Second, how this process works physiologically, step by step, in plain language that makes real sense. Third, the warning signs that most people are already dismissing as normal aging. And fourth, a specific step by step plan for what you can do right now, today, to stop the damage and start protecting your joints. I promise you, by the time this video is over, you are going to understand your own joints in a way that no doctor has ever taken the time to explain to you. Most people get this wrong. When someone tells you that sitting is bad for your joints, you probably picture it like a squeaky door hinge. Just a little friction, a little wear, something that needs a drop of oil. But what is actually happening inside your joints when you sit for extended periods is far closer to a garden hose that has been kinked, left dry, and slowly started to crack from the inside. Here is what I mean. Every joint in your body, your knees, your hips, your spine, is cushioned by a substance called cartilage. Cartilage has no blood supply of its own. That is crucial. Instead of being fed by blood vessels the way most of your body's tissues are, cartilage gets its nutrients through a process called diffusion. Think of a sponge. When you squeeze a sponge and release it, it draws in fluid. That is exactly how cartilage works. When you move, when you walk, bend, shift your weight, your cartilage compresses and expands, pulling in synovial fluid, the lubricating liquid that fills your joints, and with it, oxygen and nutrients. Now, what happens when you stop moving for 30 minutes, an hour, 2 hours? The sponge stops squeezing, the fluid stops circulating. The cartilage begins to dry out, quite literally. The cells inside it start to go without the oxygen and nutrition they need. And when cartilage cells are starved, they do not simply wait patiently. They begin to break down. They release inflammatory chemicals, a process called catabolic signaling, that actually begin to eat away at the cartilage matrix from within. Meanwhile, the muscles surrounding the joint, which are supposed to act as shock absorbers and stabilizers, go slack. They shorten. They lose the tension that keeps your joint aligned and protected. Your hip flexors tighten, pulling your pelvis out of its neutral position. Your glutes, the large, powerful muscles in your buttocks that are supposed to carry much of your body weight when you stand and walk, essentially fall asleep. Researchers have a term for this. They call it gluteal amnesia. And when your glutes forget how to work properly, the forces of every step you take get redistributed to your knees, to your lower back, to joints that were never designed to bear that load alone. Now, here is the critical question: why are people over the age of 60 specifically more vulnerable to this process? Three reasons, and I want to be very direct about each one. First, cartilage thickness naturally decreases with age. By your 60s, the protective padding inside your joints is measurably thinner than it was at 40. The margin for damage is simply smaller. Second, the synovial fluid inside your joints becomes less viscous, less thick and lubricating, as estrogen and certain hormones decline with age. This is true for both men and women, though women experience it more sharply after menopause. Less viscous fluid means more friction. More friction means more heat, more inflammation, more breakdown. Third, the rate of cartilage cell repair slows dramatically with age. When you are young, cartilage damage is still relatively poorly repaired. Cartilage has always been slow to heal, but at 60 and beyond, the repair process is even slower. Damage accumulates faster than it can be addressed. This is not your fault. It is a biological reality of how the human body changes over time. Changes that were never designed for the kind of sedentary lifestyle that modern chairs, desks, and screens have created. You are dealing with a body built for movement, trapped in an environment designed for stillness. The symptoms of prolonged sitting damage can be deeply misleading, and getting them wrong can lead people to take exactly the wrong action, including resting more when they should be moving more. Symptom number one, and this is the one that sends people in completely the wrong direction: the pain that gets worse after you rest. Most people assume that pain is a sign they need to stop and sit down. And for many injuries, that is true. But when the problem is the sitting, when the issue is that your joints have been starved of fluid and your muscles have locked up, resting often makes it worse, not better. You sit because your knees hurt. Your knees hurt more because you sat. You sit more because now they hurt even more than before. It is a cycle that can go on for months, and most people never realize they are in it. If you have noticed that your joint pain is most intense not during activity, but after long periods of sitting, first thing in the morning, or after a car ride, or after watching television, that is your body telling you something very specific. Symptom number two: swelling and warmth in a joint that seems to come from nowhere. You did not injure yourself, you did not fall, you did not do anything unusual. But one morning your knee is puffy and warm to the touch, or your ankle looks bigger than the other one. What is happening here is systemic. The inflammatory chemicals released by starved cartilage cells do not stay politely inside the joint. They trigger a whole body low grade inflammatory response. Your immune system responds. Fluid accumulates. The joint swells. People see a swollen ankle and think heart problem, or blood clot, or a bad food reaction. And sometimes it is one of those things, and you should always have swelling checked. But chronic low level swelling that comes and goes, especially in the lower extremities, after a period of inactivity, that is your joint signaling that the inflammatory process is underway. Symptom number three: pain in your lower back or hips that has been diagnosed or self diagnosed as arthritis, a pulled muscle, or just old age. Here is what I see constantly. Someone comes in with hip pain that they have been managing with ibuprofen and heat for 6 months. They assume it is bursitis or a pulled muscle or simply the toll of the years. And sometimes it is. But far more often, what we are looking at is a hip flexor that has been chronically shortened from prolonged sitting, gripping the front of the joint, pulling the femur forward, compressing the cartilage in a way that generates constant low level pain. The pain does not feel like a muscle pain, it feels deep. It feels like a joint pain because over time it becomes a joint pain. And the treatment is not rest, it is specific movement and stretching that most people never receive. Symptom number four. This one is especially important for the caregivers watching: a change in mood, motivation, and mental sharpness that seems unrelated to anything physical. Research in the last decade has made something very clear. Prolonged sitting is not only a joint problem, it is a circulation problem. And when circulation is compromised, particularly in older adults, the brain is affected. We are talking about fatigue that does not lift even after sleep, a flatness of mood, a kind of low grade fog, reduced interest in activities that used to bring pleasure. Caregivers, if someone you love has become notably less engaged, less mentally sharp, more fatigued, and more pain avoidant over the past year, and they are spending significant portions of the day seated or in bed, please do not dismiss this as depression alone or simple aging. The body and the mind are not separate systems. A body that is not moving well is a brain that is not receiving what it needs. Let me be straightforward with you now because I believe you deserve the truth delivered clearly, not wrapped in gentle language. If the damage from prolonged sitting is left unaddressed, it does not plateau, it escalates. And it escalates in three distinct stages. Stage one is what most people are living in right now and do not fully recognize. It is a stage of functional loss, morning stiffness that takes longer and longer to resolve, gradual reduction in how far you can walk before discomfort stops you, choosing the chair closest to the door, taking the elevator instead of one flight of stairs, not because you are lazy, but because the stairs genuinely hurt. In stage one, the damage is real, but it is still substantially reversible. This is the stage where intervention works best. Stage two is the stage of structural change. Cartilage that has been repeatedly starved and inflamed begins to thin and fray at the edges, a process that shows up on an X ray as joint space narrowing. The synovial membrane, which produces the lubricating fluid, becomes chronically inflamed, a condition called synovitis, and it no longer functions efficiently. Muscle imbalances that began as tightness become actual atrophy. The muscles physically shrink from disuse. In stage 2, the changes are less reversible, though they can still be substantially managed and slowed. Stage 3 is the stage where quality of life changes permanently. Advanced cartilage loss means bone on bone contact, and bone on bone contact in a weight bearing joint is not a manageable inconvenience. It is severely limiting pain. It means surgical conversations. It means knee or hip replacement becoming not a future possibility, but a present necessity. And for many older adults, surgery at this stage brings its own serious risks: infection, blood clots, prolonged recovery, and in some cases, complications that change the trajectory of their remaining years entirely. I am not sharing this to frighten you. I am sharing it because the stakes of ignoring this condition are real, and you have every right to understand them clearly. Now, there are certain symptoms that should not wait for a scheduled appointment. These are not wait and see symptoms, these are go now symptoms. If you experience sudden, severe joint pain that comes on without injury, go now. If a joint becomes red, hot, visibly swollen, and extremely tender to the touch, especially with fever, go now, because this can indicate a joint infection, which is a medical emergency. If you have any joint pain accompanied by chest pain, shortness of breath, or a calf that is swollen, red, and painful, go now, because a blood clot must be ruled out. If you suddenly cannot bear weight on a leg that was manageable yesterday, go now. And if a fall has occurred, even a minor one, and any joint is swollen or the pain is significantly worse than usual, go now. Do not wait to see if it improves. Let's shift gears from the why into the what do I actually do right now? Because knowledge without action doesn't help you. Step 1. The first and most immediate thing you need to do is break the sitting cycle. And I'm going to give you the exact rule that makes this manageable. Stop sitting for more than 30 minutes without interruption. That is the threshold. Research is consistent on this number. After approximately 30 minutes of stillness, the inflammatory process inside your joints begins. You do not need to run, you do not need to go to a gym. You simply need to stand up and move, even briefly, before the 30-minute mark arrives. Set a timer on your phone. Use a sticky note on your television remote. Use whatever system works for you. When the timer goes off, you stand up. You walk to another room. You do 5 to 10 gentle knee lifts or a short walk to the kitchen and back. Or you simply stand in place and shift your weight from foot to foot for 60 seconds. Then you may sit back down. This one change, breaking the sitting cycle every 30 minutes, has been shown in multiple studies to meaningfully reduce joint inflammatory markers in older adults. It is the single most impactful thing you can do, and you can begin it today. Step 2. Once you have established the 30-minute rule, add a short movement sequence, 2 to 3 minutes, every time you stand up. I am going to describe three specific movements, and I want you to notice that none of them require equipment, special clothing, or getting on the floor. The first is a standing hip circle. Stand behind a sturdy chair, hold the back lightly, and slowly rotate each hip in a wide circle, 5 times in each direction. This directly restores circulation to the hip joint and begins relubricating the cartilage. The second is a gentle knee bend. Still holding the chair, bend both knees slightly, about a quarter of the way to a full squat, and straighten. 10 repetitions. This compresses and releases the knee cartilage, pushing fluid back in. The third is a calf raise. Rise onto the balls of your feet, then lower slowly. 10 repetitions. This activates the calf muscles, which act as a pump for venous blood return from the legs, directly addressing the lower limb circulation that prolonged sitting compromises. 2 to 3 minutes every time you stand up. Step 3. Know precisely when to escalate to medical care, and do not let embarrassment or stoicism delay this. If your joint pain is limiting your ability to perform daily activities, dressing, bathing, preparing meals, walking to your car, that is not a physical therapy level of concern. That is a physician visit. See your primary care doctor first. They can order imaging, rule out other causes, and refer you appropriately. If the pain is acute, sudden, severe, associated with swelling, go to an urgent care clinic or an emergency room, not a scheduled appointment next week. Time matters in acute joint inflammation. Do not wait. Step 4. If your doctor recommends imaging or a specialist consultation, here is what to expect, and none of it should frighten you. An X ray of a joint is painless and takes minutes. It shows bone structure and joint space, meaning how much cartilage cushion remains. An MRI, which may be recommended if the X ray is inconclusive, shows soft tissue, cartilage, tendons, the synovial lining in much greater detail. Neither procedure involves needles or discomfort beyond lying still. If inflammation is significant, your doctor may recommend a joint injection, either a corticosteroid to reduce inflammation or a hyaluronic acid injection to supplement joint fluid. These injections are generally performed with a very fine needle, take a few minutes, and most patients describe the discomfort as mild and brief. They are not cures, but they can substantially reduce pain and restore function during a rehabilitation phase. There is nothing to fear about understanding your options. Now let's talk about long-term protection, because once you have interrupted the cycle and begun managing your symptoms, the goal is to make sure this never escalates again. Prevention pillar number 1. Move with intention every single day, even when you feel fine. Joint health is not a reactive process, it is a maintenance process. The synovial fluid that lubricates your joints is only produced and circulated through movement. On the days you feel good, that is precisely when your movement is doing its best work, maintaining fluid production, keeping cartilage cells nourished, preserving muscle engagement around the joint. 30 minutes of low impact movement daily, walking, swimming, cycling, tai chi, water aerobics, maintains what you have. Aim for it 6 days a week and give yourself one genuine rest day without guilt. Prevention pillar number 2. Review your medications with your doctor, specifically for any that may be affecting your joints or masking pain in ways that lead to overuse. This is one that people rarely hear about. Certain common medications, including some statins, some diuretics, and long term corticosteroid use, can affect joint tissue, muscle integrity, or pain signaling in ways that make joint damage either more likely or harder to detect. Long term corticosteroid use, in particular, can accelerate cartilage breakdown over time, even while reducing short term inflammation. If you are on any of these medications and experiencing joint symptoms, have a direct conversation with your prescribing physician. Ask specifically, is there anything I am taking that could be affecting my joint health? You deserve that conversation. Prevention pillar number three. Pay close attention to where and how you sit, not just how long. Chair height matters enormously. If your chair is too low, your hip angle becomes acute, less than 90 degrees, and the compressive force on your hip cartilage increases substantially. Your chair should allow your feet to rest flat on the floor, with your knees at roughly a 90-degree angle and your hips at or slightly above knee height. If your chair is too soft and you sink into it, place a firm cushion underneath you. When you sit, avoid crossing your legs. This creates a rotational force through the knee and hip that, sustained over hours, contributes to uneven cartilage wear. And whenever possible, alternate between sitting and standing throughout your day, not just when the timer goes off. Prevention pillar number four. Prioritize anti inflammatory nutrition as a daily habit. This is not about a dramatic diet overhaul. It is about consistently including foods that reduce systemic inflammation, the same inflammation that is driving cartilage breakdown. Fatty fish, salmon, sardines, mackerel, 2 to 3 times per week provide omega 3 fatty acids that directly suppress inflammatory cytokines, the same chemicals released by starved cartilage cells. Colorful vegetables and berries supply antioxidants that neutralize free radicals generated by joint inflammation. And reducing ultra processed foods, refined sugar, and seed oils, which are prominent in the standard Western diet, removes the primary dietary drivers of systemic inflammation. You do not have to be perfect, be consistent. Prevention pillar number five. Maintain a healthy body weight or work steadily toward it. Every pound of body weight you carry applies approximately 4 pounds of force through your knee joint when you walk. That is not a metaphor, that is biomechanics. At 10 pounds of excess weight, your knees are managing 40 additional pounds of force with every step. Over thousands of steps per day, over years, the cumulative impact on cartilage is substantial. Even a 5 to 10% reduction in body weight has been shown in clinical research to meaningfully reduce knee pain and slow cartilage degradation in overweight older adults. I am not asking you to achieve a number on a scale. I am asking you to consider that every small sustainable step toward a healthier weight is a direct gift to your joints. Prevention pillar number six. Strengthen the muscles that protect your joints with guidance, not guesswork. The quadriceps, hamstrings, and glutes are the primary muscular protectors of the knee and hip. When these muscles are strong and engaged, they absorb impact before it reaches the joint. When they are weak or inhibited, as they become after years of prolonged sitting, the joint bears forces it was not meant to bear alone. A physical therapist can design a strengthening program specifically calibrated to your current joint status. This is not optional extra credit. For adults over 60 with joint concerns, a supervised course of physical therapy is as important as any medication in long term joint preservation. Before I close, I want to address a group of viewers who may not be here for themselves, but for someone they love and care for. If you are caring for an elderly parent, a spouse, or another loved one who is largely bedridden or has limited mobility, this section is for you. For individuals who cannot stand or walk independently, prolonged stillness creates a compounding problem. Without the compression and release of normal movement, joints, particularly hips and knees, develop what is called contracture, a shortening and hardening of the surrounding tissue that makes the joint progressively more difficult to move passively or actively. This is painful, it reduces quality of life significantly, and it is largely preventable with consistent passive range of motion care. If your loved one is in bed for significant portions of the day, work with the healthcare team to establish a schedule of repositioning, shifting their position at minimum every 2 hours to reduce joint compression and pressure on soft tissue. If they are able to be transferred to a chair, even for 30 to 60 minutes twice daily, that change of position is meaningful for joint health. Learn basic passive range of motion exercises from a physical therapist, gently moving the hip and knee through their natural range without forcing, and perform these during care routines. Watch for signs of joint contracture, a limb that is beginning to rest in a fixed position that becomes increasingly resistant to gentle movement. Watch for unexplained discomfort during repositioning or transfers. This may indicate developing joint inflammation that needs medical assessment. Please do not be embarrassed on their behalf. This is a clinical medical reality, and your attention to it is one of the most profound acts of care you can offer. Let me bring everything together for you because you have covered a lot of ground today, and I want to make sure it all lands clearly. What is it? Prolonged sitting, anything over 30 consecutive minutes, deprives your joint cartilage of the fluid and nutrients it needs to survive. After 60, your cartilage is thinner, your joint fluid is less viscous, and your repair rate is slower, which means the damage from inactivity accumulates faster and lasts longer than in younger adults. The warning signs: pain that worsens after sitting rather than after activity, swelling that appears without a clear injury, hip and back pain that has been written off as arthritis or a pulled muscle, and cognitive or behavioral changes in older adults with limited mobility, signs that the whole body, including the brain, is not receiving adequate circulation. The solutions and prevention: break the sitting cycle every 30 minutes without exception. Add a brief 2 to 3 minute movement sequence every time you stand. Review your medications with your doctor for joint related side effects. Optimize your sitting posture and chair height. Build anti inflammatory nutrition into your daily habits. Work steadily toward a healthy weight. And strengthen the muscles that protect your joints, with professional guidance if possible. Your joint health is not a small thing. It is deeply connected to your independence, your mobility, your mental clarity, and your quality of life in the years ahead. Every 30-minute timer you set, every time you stand up and move when you would rather have stayed seated, is an investment in that future. If this video has given you something valuable today, please hit the like button. It costs you nothing and it tells the platform that this information matters. Share this with someone in your life who needs it: a parent, a spouse, a friend who has been complaining about their knees for the last year. They may never look for this on their own. And if you are not yet subscribed to this channel, I would be honored to have you. What you will find here is straightforward, honest senior health education that doesn't talk down to you and doesn't hold back the important information. Hit the subscribe button and the notification bell so you never miss a new video.